I love this week's medical disruptor so much that I made an appointment to see him, and you will too. For anyone with chronic issues, of course, we already know that you have to do the nutrition and the exercise and the sleep. But there's one more piece that's missing and so many people overlook, and that's when your central nervous system is activated. If you're battling unwellness, your system can get stuck on overdrive. And if you don't fix it, you don't really get fully better. And that's where this week's medical disruptor comes in. Dr. Navas Khabib is the best-selling author of Activate Your Vagus Nerve. He helps people calm their nervous system by activating the vagus nerve, and wait till you hear about it. He's also the host of his own podcast called the Health Upgrade Podcast and founder of an online functional health clinic where he works with people all over the world, including me as of November. He works with people all over the world heal their issues by activating their vagus nerve. Welcome to the Medical Disruptor Podcast. Dr. Habib, thank you so much for being here. I read your biography and I'm really excited to have you here.
I'm excited to be here with you.
So, as you know, this is called the Medical Disruptor, and my audience and I are going through a journey all over this country, meeting the most amazing humans in the world. So before you reveal to us what it is that you do, can you tell us what life was before, and then what was your moment or woman, and then why did you decide to come to the crazy town?
Yeah, crazy town's a good place to be, but you only realized it after years of kind of being in the system. And I started off in kind of knowing that I was going to be in healthcare somehow. I always kind of, through high school, had a very strong bias towards the sciences, particularly towards the anatomy, biology side of things. Specifically, the brain was really I had a draw towards being potentially like a neurosurgeon or something in that sense. And I started talking to a lot of doctors to figure out what I wanted to do. And there was a really overwhelming sense of don't go into medical, don't do MD. This is a real common word. Don't get into being an MD because the system is so rigid. This was something that I heard time and time again. And yeah, I wrote my MCAT, but I didn't even apply to med school. I actually had really positive experiences with chiropractors, family friend that really helped me with back pain. And I started having conversations. There was one anesthesiologist I remember who I was observing a surgery during high school, and I was in and I was talking to the anesthesiologist, and he goes, don't do med school. He goes, go be a chiropractor. He goes, the lifestyle is much better.
Run.
That's crazy. Obviously, that's not the only reason why I would get into something, but the draw for me was really that I was always trying to figure out that brain-body connection. I know that the brain and the body are one in themselves, right? Like they're inextricably linked, and they're constantly in communication with one another. But it just wasn't the explanations that I had been given weren't good enough.
Do you think they're connected in your body?
No, we're all like, there's 12 body systems and they don't talk to each other.
Because the neurologist's office is very far from orthopedic, so they can't possibly be connected.
Floors. It's the brain.
Back to you.
It was this whole idea that, yes, it's connected, but what is that connecting point? And what was this curiosity that came on my side to try to figure this out for myself, to try to dig into this and really understand what connections are actually there that are allowing our body to work in unison with one another. I'm also a little bit of a linguistics nerd, and the word health actually comes from the root word whole. To become whole again is to create health, right? It's really funny when we say now holistic health, we're actually saying whole or holistic. It's kind of funny.
Wow, that's pretty cool.
So health is the becoming of being whole again. And it was, before I got into this, I was doing chiropractic work. I graduated from CMCC in Canada here, and was working for a few years as just getting to know what I was doing in practice. I was an associate at a couple of practices, ended up buying my own practice, and the redundancy and the challenge for me really came up. I was about 4 or 5 years into my practice owning it. And I remember I was seeing the same patients every week with the same issues. right? And I was doing the same treatments. I was doing acupuncture, I was doing soft tissue therapy, manipulation, IFC, like electrotherapy, and you name it. I would learn all of these modalities to help try treating my patients, help them get better. And I wasn't getting a result that was lasting for a long time. I just wasn't feeling like the things I was doing were able to really change the course of someone's life. That I had just become.
Sorry, this is while you were a chiropractor.
While I was a chiropractor.
So what you were saying is that first, I never went into MD school because I felt it was so restrictive. I thought chiro was like the answer. But then when you're in chiro, you still felt it was still like not really moving the needle on health.
I will say that I think the mindset of chiropractic is very much, let's try to find that root cause. Let's try to find out why things are happening. So I think the mindset behind a chiropractor is a little different than a medical doctor. That said, when we're pulled into a system that's almost the exact same, the insurance-based world, where we're working with motor vehicle accident patients or workplace injury patients, and it's just this rhythmic, you have to go through this certain amount of
bill, rinse, repeat.
Exactly. And that's so frustrating for somebody who just felt like there wasn't a good enough answer. I didn't have the answers that I could give to my clients to make them feel better. Yes, I got people better after they had a car accident, and 10, 12 weeks later, they tended to be significantly better. And maybe we accelerated the healing process by some extent. But I never felt like I was changing somebody's life significantly for the better. And it had a lot to do with myself. I actually was, during this time, overweight, dealing with my own health struggles. I weighed 250 pounds, had high blood pressure. I was borderline diabetic. And I was seeing a doctor, and they were trying to get me to go on medications during this time. It was in my 20s. And so I was not only providing this care that I found was subpar, but that care was being provided to me. And the answers that I was getting weren't good enough. It just didn't feel like it was the right connecting kind of area for me. I didn't feel like I was really able to shift somebody's life in a positive way. And that really started with myself. I knew I needed to get my own health. Exactly. And I needed to get myself at least moving in the right direction before I could go and do these things. The story of, I believe it was an ancient healer in Ayurvedic times who had people come to him and ask, should I do this or should I do that? If he wouldn't provide an answer right away, he would say, come back in 3 weeks. I'll give you your answer in 3 weeks. It was something like, should I cut off sugar or something along these lines? Should I stop eating all these sweets? And he would bring them back 3 weeks later to just provide an answer to what sounded like a simple question. But he said to his people when they came back 3 weeks later, and he said, yeah, you should cut it out. They asked the question, why did you make us wait 3 weeks for you to tell us this? And he said, if I'm not doing it myself, I shouldn't be providing that information to you.
Oh, nice.
So he had to do it himself and try to experience it and live it in order to provide that information. I, to some extent, live my life in that same way, where if I want to provide recommendations or tools or protocols or some sort of therapeutic advice, I at the very least need to be either trying it or have tried it in the past in order for me to be able to then share that information with you.
For you, it was more of a gradual realization. It wasn't like some of my, like for me, my wife was ill. Some of my friends, the wife, or they had this moment, or pediatrician that I had recently, she said, I went to school, I finished school, and then I realized I was a fancy farmer rep.
Yeah.
So for you, it wasn't like this light bulb moment. It was this gradual unraveling.
I would say the dimmer switch was slowly going up.
And that's important too for our audience, because some people will see a post or a tweet and be like, that's it. I'm done with gluten, I'm done with sugar. And they just jump in. And for many of us, myself included, in terms of your personal journey, it's okay if it takes time, right? And even now, there's still more to do, right? It's not like you're there. There is no there.
And that's the key thing to understand, is that becoming whole or working towards that health feeling is a journey. Even for our patients, right? We have to tell our patients that it's a journey, but we have to live it as a journey. And that requires us to show up every day or as often as we can. And there's going to be days where we fall off, right? We've all seen those entrepreneurship parts where you have a bad day, but you get back on the horse and you keep moving, and it gradually moves upwards. That's totally the journey that I want to provide.
And also, the thing that I'm seeing I'm hoping my audience is getting is that providers, we evolve also. Like the care that you gave 20 years ago is different. Not, it's different. And we evolve as our mindset evolves. And that's okay too. It's okay. It's great that we evolve. Okay, so this brings us, so you did all the things and you changed, but now you do a thing. What is your thing?
I got into functional medicine, and that moment for me where functional medicine really came into my line of sight was one of those light bulb moments, but it was kind of with an external source. I was working at a chiropractic office. I was helping out a friend in Mississauga here in near Toronto, and I was in a spot that I'm never standing on a day that I'm usually either in the back or not. I wasn't in this space very often. It was a very rare occurrence that I would be in this space at this exact time. And a gentleman walked in and he said that his wife had been in a car accident, that she needed some therapy. They lived upstairs, and that he himself was a chiropractor. And I said, if you're a chiro, why don't you just do the care for her? Why don't you just provide the services for her and bill the insurance and you get it yourself? And he goes, I don't practice that way anymore. And I said, what else does a chiropractor do if not chiropractic care?
Yeah.
He said, I practice functional medicine. And so he went into the office to get paperwork started. I ran to my office and I started typing out, what is functional medicine? And that's where the light bulb went
Ooh,
on.
you had a little bit of an aha moment. I like that.
Exactly. So the dimmer switch went a little
A
faster.
little bit further. Start
But there were
flickering.
moments throughout the entire journey where the dimmer switch was going, but this was one of those key moments. This gentleman, his name is Sachin Patel. He literally lived in the condo building upstairs from where the clinic was that I was living in. And he just happened to be in the right place at the right time to help guide me. As soon as I Googled what this was, I caught up with Sachin as he was walking back to his condo. And I said, you need to teach me. I'm tired of doing what I'm doing. I need to fix what I'm doing. I need to fix myself. I need to get these things out. And he was very gracious and got me started with, we would meet up at a coffee shop at 7 a.m. couple times a week. And he would get me moving and understand what health was and start looking at functional lab testing and realize that this whole other world existed underneath what I was already practicing. And that when I didn't limit myself within what the insurance companies were going to pay, I could provide real life-changing care, not only to myself, but to others. And that's where I started to really understand what health meant. It was not simply the absence of disease as defined by the medical system. It was the journey to create that wholeness feeling inside myself and my patients. That was the ultimate moment.
It's so painful. It's now you can't unsee it.
Yeah.
Like, you can't unsee it. But like, to think that you wasted not wasted, I shouldn't say waste, nothing's a waste. You think that you spent so much time not knowing that this universe existed.
Yeah.
And that there's so many millions of people who still don't know. And that so many people will still call us crazy charlatans, snake oil salesmen.
I don't know that I'm on Quack Watch yet, but I'm working.
I'm sure. I never checked. If I'm not, I'm well on my way. Quack Watch.
We almost now think of it as it's a badge of honor to be on.
Yeah, absolutely. Absolutely. But it is painful to see the liners people are like, wow, that's a great story. Okay, so now you do this thing. What is that you do? What's your niche? You have a niche.
My niche is, it kind of goes back to that interest between that brain-body connection and how everything talks to each other, how the communication occurs. My niche is helping people fix their vagus nerve, understand the root causes of their health challenges, the things that are triggering inflammation in their body, and realize that the pathway to control that inflammation is actually broken down, deteriorated, not functioning. And that pathway is the vagus nerve. And the vagus nerve has been kind of completely misunderstood, not looked at, ignored is a good word, for such a long time. But we're now realizing in the research.
Hiccups only.
Yeah, exactly. Hiccups and epilepsy. Those are the two things, right? If you have seizures or hiccups, those are your two.
So the only
That's
time
where
those
vagus
are
nerve is related. Now we're realizing that it's involved in literally
everything.
Process.
Wait, can you tell our audience what the vagus nerve is?
It's the 10th cranial nerve, and we're saying it. There's actually two of them. They're branches out of the brainstem. We have 12 pairs of cranial nerves that come out of the brainstem, and those tend to stay in the head and neck area. They're the ones that are involved in our sight, our taste, all of those like facial movements. But the vagus nerve, being the 10th of those 12 pairs, comes down, and it's the only one that leaves that head cavity. It goes down in the neck beside the carotid artery and the jugular vein in a little tissue called the carotid sheath. So if you find your pulse in your neck, you're actually within a few millimeters of it. The vagus nerve continues down. It sends branches a little bit to the ears, to the back of the throat muscles, the pharyngeal muscles, to the laryngeal muscles. So the reason I can go really low or really hollow with my voice is because I'm tensioning and lengthening my laryngeal muscles with the branch of the vagus nerve. So vagus nerve is involved in tonicity of your voice. Then it comes down into the thorax and it attaches to your heart and it attaches to your lungs in a vast array. Then it continues down with the esophagus and it attaches to, it goes through the diaphragm, not attaching to, but through the diaphragm. And then it innervates literally every single organ that we have in our abdominal viscera. Stomach, gallbladder, liver, kidneys, small intestine, large intestine, pancreas, you name it. Every organ has a direct connection to the brain through the vagus nerve.
So I just want to make sure that the gravity of what you said, just that was such a clear image. Like I saw it and I'm thinking about my anatomy book. So thank you for that. I think anyone who's listening to this podcast can see it. But it's really important because people say mind-body connection and they almost feel it's like a woo-woo tree conversation. It is literally, physically connected, a highway from your brain, through your neck, through your chest to every organ. So if anyone tells you mind body is nonsense, like they're just wrong, just wrong.
Straight up wrong.
Just thinking about the potential of that. Okay, all right, great. So it's connected. So what? Dr. Khabib, who cares?
How do we know what's going on in the heart? How do we know what's going on in the kidneys? How do we know in our brain? How does our central nervous system processing unit understand what's happening in our gut? If you've ever had a feeling after you've eaten something that your gut is just not feeling great, something is off, something feels dysregulated, not right, that's your vagus nerve sending information from that organ up to the brain telling you this is not right. That sense is called interoception. That's another sense that we have. We're really good at knowing about our 5 senses. There's a few more that we haven't thought about. And one of those is interoception, is understanding and being able to feel and experience what's happening within our body and experience that. And that, where we have a disconnection in that interoception, actually is incredibly strongly linked to mental health conditions, to chronic inflammatory conditions, to autoimmunity, to you name it. Any chronic health condition that has an inflammatory component to it has a direct vagus nerve link. And if the vagus nerve is not functioning well, then the signals from those organs to the brain are not going to get there. And the signals from the brain to control the inflammation in those organs is not going to get there. And then we get these situations of chronic disease.
Oh my God. So the patients, our patients who come in and tell us rightly, I know my body, something's off. It's actually physical. It's actually, we're designed to actually be able to make that statement.
Isn't that weird?
Isn't that weird? Because what do we, in medicine, what do we say in allopathic medicine? Okay, but did you Google your sister? You didn't go to med school, you don't know. And the patient like, I know my body.
Yeah. And my favorite is, it's all in your head.
It's all in
your
head.
How did it get in your head?
Not in your head.
How did it get in my head?
Listen to that. How to get there, how the information get there. This is groundbreaking, right? The patient who says, I know my body, you do, not only do you know it, Mrs. Smith, Mr. Smith, not only do you know it, but you were designed to know it. And so listen to that. Oh my God, this is life-changing. Okay, now what? So what do we do with this?
We figure out what's causing the vagus nerve to not work. It's a nerve. Just like every other nerve in our body. We know what it means.
How do I know it's not working?
So let's talk about that. There's a few different things that we can look at to tell us whether it is or is not working. And we're living in a time where it's actually really accessible to find this information out at a very high level. The number one thing you want to look at is your breathing. Your breathing is really the regulatory function and how we can actively, with our self-awareness, change the way that our vagus nerve functions. Okay. So assessing your breathing. I get my patients to do a hand on their chest, a hand on their belly, and take a breath and see what's happening. Are they breathing with their chest or are they breathing with their belly? So when they inhale, is the hand that's on the chest that's moving, or is it the hand that's on the belly that's moving? And 9 times out of 10, the hand that's on the chest. And that's telling me that they're pushing towards not turning on their vagus nerve. So the vagus nerve is a major component of what's called our parasympathetic nervous system. This is one component of our autonomic nervous system. So all of the internal functions that are occurring in our bodies that happen without our conscious control, they're automatically happening. So I'm not currently thinking about the lunch that I'm digesting. I'm not currently thinking about the heart beating and going to control that heartbeat, right? These things are happening automatically. Those signals that need to get there happen through this autonomic nervous system. And there's 2 sides to this autonomic nervous system. One is the sympathetic nervous system, which we know as the fight or flight. And then the opposite side of this is the parasympathetic nervous system. That's where the vagus nerve lies. And that directs information that's rest, digest, and I've added recover, because we cannot heal when we're in fight or flight. We need to be in this parasympathetic rest, digest, and recover state in order to create a healing response. So when we're in the sympathetic state too much, when we spend too much time there and our bodies break down, this triggers more inflammation. It puts us in this state of being actively dysregulated all the time. It's the startle reflex that we get when we hear a honk or a loud sound or somebody jump out in front of us. That's happening often for people all the time. And that's what a lot of people are living in today, right? Our modern society is so full of just constant input and constant sources of stress. And we've set ourselves up in a lifestyle that's kept us in that sympathetic state so often that it's broken down the function of the vagus nerve. That's what we need to start looking at. So what we're looking at from a symptoms perspective is when we're breathing with our chest, we're turning on that fight or flight response. And when we're breathing with our belly and we're calm and we're slow and we're nasal and we're diaphragmatic with our breath, that is a sign that we're in the parasympathetic side. That slow, nasal, diaphragmatic breath is going to change everything. So assessing your breathing is one of the number 1 ways to look at if you're turning your vagus nerve on or off, okay? Based on the time that we live in, we have access to wearable technology, which I think is incredibly empowering. And I think that is the biggest tool, because now not only can we check our heart rate at any moment, any given time, but we can measure something called heart rate variability.
And we've not talked about that yet on this podcast, heart rate variability. I love that you bring this up.
This is the answer to telling us, are we in sympathetic or parasympathetic, through wearable devices that can measure things way beyond what we're aware of. So heart rate variability is different than heart rate. I'll do a quick overview.
Yes.
Heart
Rate level, please.
Yes. Heart rate is the number of heartbeats in a 60-second span, beats per minute. So we want to be ideally at rest somewhere between 50, 65, maximum 70. We don't really want to be above 70 at a resting heart rate state, particularly when we're sleeping. For over that, it tells us that the sympathetic nervous system is sending inputs to increase that heart rate greater. Cool. Heart rate understood. If we're lower, we're in parasympathetic. If we're higher, we're in sympathetic. What about heart rate variability? So HRV is not a measurement of the number of beats. It's the number of milliseconds between beats of the heart, averaged over a period of time. And what that we're looking at is how rhythmic is the heart. The rhythm of the heart and the number of milliseconds, we don't want it to be rhythmic. We don't want to be with our heart beating like a metronome. If our heart is beating like a metronome, it tells us that our foot is on the gas, that we are fully in the sympathetic state, and we don't have a balance between sympathetic and parasympathetic, which is the parasympathetic being the brakes. So we want to have variance. We want to have some beats closer together and some beats further apart. And the breath is what drives that. But the more variable we are, the greater we have inputs from the vagus nerve. And that tells us how strong our vagus nerve is functioning. There's a component of HRV known as cardiac vagal tone. That is telling us, that's the strongest piece of evidence that we have telling us that our vagus nerve is working well or not. So HRV is a great way to assess whether we're in sympathetic or parasympathetic and what's happening at any given time. If the kids come home and they're screaming and my HRV dips, I can tell you exactly why.
But let me just say this for our audience. HRV, if your fingers on your pulse, we don't want you to feel erratic. That's AFib. We don't mean that. Or any type of, PVCs. We don't mean that you'll actually feel it. It will feel to you like a regular pulse. You cannot manually feel HRV. You do need some sort of wearable device that is going to count something that is not countable to us this way. Because I don't want someone to be like, oh, this is great. My heart rate, I have an arrhythmia. I don't need to go to the ER. So that's not that. Okay. It feels to you. Right. It feels to you, your heart rate is regular. And then you wear a wearable device that tells you that, hey, there's actually little differences in this beat. And if you think about it for a second visually, and please tell me if this resonates, Dr. Khabib, is that if you're like chilling, like on the ocean, you're undulating, it's not, there's a rhythm, but it's not exactly all the time. Whereas if you're marching like a soldier, like this, there is stress, there is focus, there is design there, right? So you want that smoothness, that variability to indicate that things are calm. And as we know, parasympathetic calm in Vegas, just for our audience there, I'm adding a touch of visual. And if you are marching like this with no variability, then you are fighting. Your armies are ready. Your kids came home, the dog is barking, your boss is yelling at you, right? So there is a way to measure that. And then, correct me if I'm wrong, but even just sometimes just taking that deep breath and activating, suddenly you see an increase in that undulation, that variability. Oh my God, I love it.
The analogy is perfect. And what I would love to add to that is, and I'm a water person. I love Bruce Lee, and "Be water, my friend" is one of my favorite quotes of all time. And if I go and sit on a beach and I'm watching the water and the waves come in, if you've ever watched, there is no rhyme or reason as to what the waves are doing, how far they're coming in, the timeline that they're coming in. It's rhythmic, but it's completely random, right? That complete randomness happening to some extent within our heart is actually telling us that we're resilient, that we're capable of adapting to the new challenges, new stressors, new things that are popping up. And so we want that variance, we want that resilience to be there all the time, and as much as possible be in that parasympathetic state, and then when necessary to then push the accelerator and go into sympathetic state when necessary. But it should not be happening 50, 60, 70% of the time like most of us are in today's society.
Oh my God, this is great. Okay, so we have the breathing, we have HRV. Is there anything else we could tell if our vagal nerve is activated?
Heart rate is a part of it as well.
Always acting.
Higher heart rate is going to be more sympathetic. Lower resting heart rate is going to be more parasympathetic. And then we want to talk a little bit about inflammation and gut function, because those two play major roles.
Are they major roles making us not activate our vagus nerve, or is it because our vagus nerve system, therefore our gut, or is it both?
It's a bit of both.
Okay.
If we have good functional digestion, if things are working effectively through the gut, we have good peristaltic motion, we have good movement of the food going through our gut, and it's taking between 14 and 24 hours for food to exit our body, that's a very good sign that things are moving along well. But if they're taking longer or shorter than that time, less than 14 hours or more than 24 hours for food to pass through our gut, that is telling us directly that we have dysregulation. Now, whether it's a direct vagus nerve issue or a microbial dysbiosis or some sort of stress pattern that's driving it, those need to be assessed. But the vagus nerve is involved because that gut-brain connection is literally physically made up of the vagus nerve.
Amazing. So are those all the points that could help us, the layperson, figure out if our vagus nerve is working?
That one, and then if we have had blood work in the past or more recently, measurements like C-reactive protein or high sensitivity CRP, if we have high inflammatory markers in our gut like calprotectin, or if we have other inflammatory markers, ANA, and all of these genetic kind of blood markers of inflammation, these are direct signs that we have a higher than normal level of inflammation, and that inflammation is not being controlled. And the job of the vagus nerve is to control inflammation, to understand that what inflammatory processes are occurring in certain areas, send that information up to the brain for processing, and then to signal down to the immune system cells that are present in every single one of the organs that I outlined earlier to shut down that inflammatory process.
So tell me this. So now I know I can kind of self-assess if my vagus nerve is on point. What would I see if it's not on point? It's not on point, you know, what are the type of things that I would see as a result?
The bigger ones are going to be dysregulated kind of emotions, inability to really just kind of hone in on a single emotion. You're easily startled. There's more anxiety.
Easily
There's
cry.
stress, easy crying, just emotional dysregulation. I'm not talking on like a hormonal based, like if depending on where you're at in your cycle, there may be some of that obviously to contribute to this, but there is an HRV change through the cycle as well. You're going to be in a more sympathetic state at certain times, a more parasympathetic state at other times. So dysregulation that occurs consistently is more of a sign of vagus nerve dysfunction. And then in addition to this, sleep issues, a huge area that people kind of miss out on. But sleep is the most parasympathetic state that we can.
Sure. You're should be the most relaxed.
That's the rest component of rest, digest, and recover. And there's some really interesting research that was done. They had put some electrodes over the vagus nerve on some rats just to monitor what was going on. And the moment they fell asleep, that the sleep waves started occurring on the EEG, vagus nerve signaling in HRV went through the roof, like huge jump the moment it happened. So while we're asleep, our vagus nerve is doing the work of creating that healing and recovery process to support the healing in the organs that have been stressed through the day. And so now we can repair any damage that's occurred through the day. This is why when we don't sleep for a long time, we wake up in the morning after a terrible sleep, we feel drained, we feel less energized, we're not cognitively capable of being present all the time. And so that is such an important piece of the puzzle. So dysregulated sleep is one of the major reasons why vagus nerve becomes dysfunctional, and it creates this lack of vagus nerve function that will allow for inflammation to.
Okay, so dysregulated, in essence, if it's dysregulated, I could also assume that my vagus nerve is not.
I will 100%, yes.
So obviously since you said it's connected to every organ, obviously it could just pretty much affect every organ. But you and I are both part of a mentorship group for people who suffer with mold, right? For providers who help people who suffer with mold, I should say. And one of the things that the mold guru, is what I call Dr. Nathan, has taught me is that on our patients who are chronically unwell, they have mold, maybe they have Lyme, they have something going on, chronically unwell. And this is important for those of you listening who are chronically unwell. You know, you can remediate from the mold, you can remediate from the Lyme, and then sometimes these patients still don't get better. Like their urine shows that it's better, you know, the Lyme is improved on the blood work and they're not better. And that is oftentimes because as they were sick and inflamed and, you know, at the height of their like hot mess level, their vagus nerve got stuck on go, right? Like never calmed down. And so even though we've remediated from mold and remediated from Lyme, they're still stuck.
Yes.
Right. And Dr. Nathan, I want you to speak about this in a moment, but Dr. Nathan has taught us, although it was probably obvious to you, he's taught me that if you don't also do work with these patients for the central nervous system, whether it's vagal therapy or he has other therapies, you're actually not going to be able to get them, even though all the lab tests will come out normal. Can you explain a little bit about that?
Yeah, that's exactly right. You've hit the nail on the head there with we're stuck in go pattern. It's almost like there's a brick sitting on the accelerator, and doesn't matter how hard you push the brakes, the car's still going, and the brakes are going to wear down over time. And the brakes that have worn down over time, sure, you can take the brick off the accelerator, but the brakes still aren't working. You need to do the work of repairing the brakes, right? You need to replace the brake pads. You need to make sure the brake fluid is there. You need to make sure that system is back up and running. So I see a lot of biochemical stressors being the reason for those bricks being placed on the accelerator. We have mold, we have Lyme disease, we have microbial dysbiosis, we have all of these biochemical stressors that we don't see, all the plastics and all the chemicals, the forever chemicals that are out there on clothing now, and all of these challenges. They're making their way into our body, and they're proverbially putting these bricks onto that accelerator, and we're wearing down the brakes. And so when we take away those brakes and we do all the therapeutic work, why we're unable to slow that car down is because the brakes physically are not capable. That's the work that needs to be done. And I would actually propose that we start doing that work immediately. Even before we get test results back. I can tell you, if you have some sort of dysregulation or your body is off, you know that there's an inflammatory trigger, you know something's going to come back on their testing, we need to be supporting that brake system first. We need to start getting that healing system going first. And here's why. If you've ever had to have your car fixed for whatever reason, changing the brakes or, changing tires, something's wrong in the engine, you take your car to the mechanic. Can the mechanic do the job while your car continues driving? Or do you need to stop the car in order for the mechanic to open the hood and get in and do the work? You need to stop the car for them to be able to fix it. Your body cannot heal in fight or flight. Your body can only truly heal when you're in a parasympathetic rest, digest, and recover mode. The vagus nerve needs to work for that to happen.
That was so clear for me. I've said it different ways, but that was so clear. So you remove the toxin, you remove the brick off the gas, but you don't know how to stop. You don't have the brakes. That is such a great analogy. And there's so much retraining that has to happen. Okay, so we know how now to find it. And we kind of understand that we're never going to get better until we fix this. We're gluten-free, we're this, taking the mold protocol. So now what do we do to fix it?
So now we become conscious of what the sources and the negative things that we're doing are creating, right? We're conscious of now the stressors. We're aware of these things. There's 4 different types of stressors we want to assess. The biochemical, we talked a little bit about. We want to talk about physical stress. We want to make sure that we're moving, but maybe not moving too much, that we're able to be capable of moving all the time. If we overdo it, that pushes us to the sympathetic side as well. But what if you had a physical injury? What if you had a concussion? What if you had a car accident? These are physical stressors that will create a challenge. What if your posture is just so terrible because you're on your cell phone for 12 hours a day like this, that your ribs are in a position to not allow your lungs to contract and expand, allowing air to make its way in? And as we know how important the breath is to the vagus nerve, we need that system to be working. We need that physical structure to be optimal. So physical stressors, in addition to the biochemical, we need to look at psychological stressors and make sure that we're not missing pre-existing trauma, right?
Oh, yes.
Were they abused as a child? Were they victim of a crime? Did they have some major psychological loss of a loved one? Did they have some sort of psychological trigger that just pushed the gas super hard and the brake could not keep up with it? So such a common thing I hear, that there's some major psychological stress mechanism involved in creating that breakdown to occur. And then the last one is these daily stressors that are chipping away, the financial challenges, the kids, sitting on our butts all day at the office, all of these day-to-day kind of lifestyle-based habit challenges. So those 4 areas need to be assessed and addressed. And the way that we start to change this is we start to become aware of how our body feels in certain situations. And the breath is the key to this. So I've mentioned the nasal, diaphragmatic, and slow rate of breathing. The key, though, is when we inhale, we're pushing the accelerator. And when we exhale, we're pushing the brake. And so just by shifting how we breathe, the number of seconds that we spend on an inhale and doubling it up on the exhale. So if it's 4 seconds in, 8 seconds out, that means we're spending more time on the exhale, and that's creating more variability in our heart rate, and our heart rate variability goes up. And what that's going to drive is vagus nerve activation. So we need to teach ourselves and our patients to breathe shorter inhale, nasal, diaphragmatic, longer exhale.
Does the exhale matter if it's nasal or oral?
Less so.
Less.
I still think the nose is the breathing tube and the mouth is the eating tube, and we have a backup in case, and that's wonderful. But the nose is but we should be using the nose.
Interesting. That is so interesting. Yeah, I love the fact that, so yes, because we're so hyper focused on toxins and like my patients who come into me and they want to do this test and this test, like, yes, we need to do that too. But what's your daily life? Are you sitting on your butt? Are you having a stressful relationship? What happened to you in the past?
Yeah.
Because we have to address that too. Whether you want to get therapy, of course, and mental health support, but understanding that has impacted you physically and got you unstuck is really big. I'm not sure if what your thoughts are on this or if you have any thoughts at all, but as you were speaking of nose breathing, the trend of taping your mouth at night, that seems to be in line with what you're saying. Yes, thumbs up.
Thumbs up. Big fan.
Say more.
Personally used it. I loved it. What mouth taping does is it teaches you and it forces you to breathe through your nose at night. And those ideally 8 hours, not everybody's getting 8 hours, as you're fully aware. Those 8 hours are passive breathing time. And remember, while you're asleep, your vagus nerve is on at its greatest. But can you imagine if in this moment where you're asleep and you're breathing through your mouth, are we actually letting the vagus nerve go to its maximal potential function if we're breathing through the mouth and we're going shorter breaths and we're breathing more rapidly? We're actually hindering how high our vagus nerve function can actually go. So I think mouth taping is phenomenal. Particularly, I've seen it used in kids. And we don't even need to tape over the mouth. I've seen it taped around the mouth where there's actually an opening around the lips, but it just forces the lips to stay in that closed position. And you do it long enough, you can train yourself. You don't need to do it anymore.
Oh, so even the ones with those holes in the middle still work? It doesn't have to be
They
fully...
work great. Yeah. I literally, and you can see I have a beard here. I just put a tiny little strip over my lips like this. I keep the sides open if I need to. Just a tiny little strip.
Oh, that probably feels a little bit better.
Because it's just a passive tool to ensure that I'm not blaringly open at night.
Oh, interesting. Because I saw the ones with the holes in the middle and I was like, wait, what? But
it works because you're not just going to open your lips for that tiny little bit to breathe there. You're going to do a lot more just by opening your nose.
And even if it is a little bit open, you're still going to be using it.
Well, you're
primarily... It might be a beginner's way to get into it because some people feel like it's too much.
Exactly.
Oh my God, I love this so much. So what do you do when you work with patients? And if patients find you, what is the work you do?
So we add in these layers of tools that support that breathing pattern. And so we make it a little bit harder. We add in these moments of stress that you then teach yourself to breathe in that same pattern during these moments of stress. So cryotherapy or cold plunges.
Oh, my cryotherapy.
The cold. And this is, we have to find each person a different way of doing it. So because it's stressful.
So stressful.
And that moment you get in, you feel that, 37-degree water, and you get in, you're like, this is insanity. It's because that's a sympathetic stressor, pushing your body into an extreme of sympathetic nature. And you take 3 to 5 minutes to breathe in the most stressful scenario possible. Imagine what you can handle after that.
It's cryotherapy. Oh man, I have to
teaching yourself to breathe in those moments makes all the difference in the world, right? So humming, chanting, gargling, activating those vagus nerve fibers and the pharyngeal and laryngeal muscles, that'll do it as well. But they all focus on that long exhale, that controlled long exhale, right? Vocalization.
When they're stressed, like
100%. That humming comes down to, the ancient function of Om.
Yes.
That vibration pattern has been shown to increase your HRV when you do that.
So it's like a self-soothing.
100% it is.
All right, so you put in cryotherapy.
You're only doing that while you're exhaling as well, right? You're not humming while you're inhaling. You're going on the exhale. So that's an awesome tool that you can use right before meals with your kids. Humming or buzzing like a bee before you eat your meal pushes you into that rest, digest, and recover state. So
that you'll eat better?
Exactly. Turn on your gut.
Oh, Fascinating.
Even laughing. Laughter is one of the greatest things we can do to turn on our vagus nerves. Laughter is so calming. And this is actually linked to this concept from the polyvagal theory. If you've ever read that book or have access to it, Dr. Stephen Porges proposed this theory, and it was very much in a psychology standpoint of the vagus nerve turns on when we feel safe.
I love.
Safety is the driver of vagus nerve function, right?
Okay,
And so
let's go back to your torture. Cryotherapy torture. What's the other torture you put your patients through as you make them?
We'll do an electrical torture. So there's this recent move towards electrical vagus nerve stimulation. And I will say it has been the greatest accelerator of progress for my patients, pushing them into that parasympathetic state more readily when we add in electrical stimulation. So got a couple of devices. I'm obviously have a bunch of these things around, but I've got like my TruVag, I've got my Pulsetto. These are great cervical vagus nerve stimulators. So they're literally these electric electrodes. You put it directly on your neck with a gel. And I've been using this consistently now for a little over a month. I'm comparing my HRV levels, my average HRV, the month prior to using this and then the month that I've been using this, it's a 23% increase in my average HRV.
So you use this, you recommend for people to do this on their own?
Absolutely. These devices are available for people to purchase on their own. And I think there's a lot of value to them. There's different ones that are auricular, that stimulate auricular branch of vagus nerve. It's a very small branch. I find those devices just take a little bit longer to get that stimulation going. But there's great fMRI studies being done showing the electrical stimulation in the nuclei of the brainstem that the vagus nerve comes into, specifically from cervical or from auricular vagus nerve stimulators. And then there's a bunch of these great biofeedback tools and these devices that help us get into this state far more readily. It's just creating a controlled period of time in which we're actively pushing towards that vagus nerve activated parasympathetic state. And these electrical stimulators have been an absolute game changer for patients. The number one thing I hear from them, I haven't slept like this in years.
Get out.
That's the number one thing I hear.
So wait, so I just want to break it down to two things because I'm hoping patients will come. So one is we're going to teach you to deep breathe as we torture you, like in
Yes.
But that's really good. That's a really good practice, or like in a stressful environment to do it.
Yes.
But then this other thing is like, now let's also at any moment also just like activate it. So I imagine that when you use this thing, it feels good. It's a calming.
I find it very calming. My daughter, who is now 7, and I helped use it when we were doing some vision therapy for her and had phenomenal results. She laughs because it tickles her.
Oh, interesting. It's pleasant sensation. It's not
Relative. It doesn't hurt.
Okay. And so you have that and you're testing it. And then you have other things that you do with your clients. So like, what's the expectation that, in other words, are you solely doing this or are you doing like functional and then you add this as a component too?
This is a major component of the entire program. So I'm doing more functional with this.
Functional with this. How long do people work with you?
Usually between 3 and 6 months. We run programs where we figure out what's going on, spend the first month getting the vagus nerve turned on as we're getting the test results in, as we're figuring out what needs to be done from a targeted biochemical approach. And then as we continue to improve the vagus nerve, we then are targeting those biochemical or physical or emotional stressors.
So I imagine people need to come into your office then.
So funny enough, I do everything online. I work with people online entirely. It's wonderful because these devices can be purchased by anybody and can be ordered. So you do these at home. And I work with people with good communication that we use on our systems to just have things work in a very positive way. And you don't need to wait in an office for me. You don't need to sit in a waiting room. You don't need to. So it doesn't matter where you are. I work with people all over the world.
Oh my God, that's great because we have listeners all over the world. We do. Our podcast, for some reason, is popular like all over the.
Love it. I know I have my own podcast and I found out that we're like number 82 in Lithuania or something.
Yeah, like the random countries. Like this is, we shouldn't say random. They're random to us from my perspective. But amazing countries. Unexpected, I should say. Unexpected. Thank you for giving me a better word. Unexpected countries. That's great. Okay, tell our audience how they can find you.
So the best ways to get to know where I'm at, I have a book called Upgrade Your Vagus Nerve. This one came out just this year. Phenomenal kind of breakdown of all of the research that I put together and my last 5 years of clinical practice. This has been a labor of love, and it's in great shape, kind of helping people figure out the science behind it and how to address things with real science-backed therapies. And then you can follow me on Instagram, Dr. Navas Khabib. And probably in the next month or so, we're going to have a course coming out on upgrading your vagus nerve that is more of a DIY type of course. So
Oh my God, I love that.
if you jump on the website, healthupgraded.com, and join our 10-day vagus nerve jumpstart program, which is just an email a day for 10 days, we'll get access to the course coming out to everybody who's on the email list very soon.
Perfect. That is so exciting. Is there anything that I didn't ask you or that you want to say?
I think we covered most of it. I think we're in pretty good shape.
Oh, you're in very good shape. Okay, amazing. So anyone listening, this needs to be a piece on your journey. Like whatever you're doing, whatever diet you're following, whatever protocol you're on, you need this piece to take it to the, not just take it to the next level, to make it work, to make what you're doing work.
Yeah.
It's foundational. I thank you so much for being here. This was a great talk.
This was wonderful. Thank you.